back to Appalachia Rising. It's great to be here today down in Whitesburg, Kentucky, and we're talking to Van Breeding. Van is the head of the clinic here, but they're doing some fantastic things down here in Whitesburg in another great little town in central Appalachia, and we wanted to make sure that everybody had an opportunity to hear and to replicate. So Dr. Breeding, welcome.
Thank you. Good to be here, and glad to have you over to Whitesburg to see our clinic.
Absolutely. Now, Van, this is my personal clinic. This is where I come to get my health care done. And that grew entirely out of the first meeting that you and I had, where you told me just a few of the fantastic things that are going on here. And when we started this podcast, I was talking to our producer, Laura, and I said, we have got to get down to Whitesburg. And I think we tried to get you for like 3 months before we were able
hard to get in
you.
to
yeah,
your schedules, right?
It's hard because you're busy. So just talk to me about some of the really interesting things you're doing here that, frankly, everybody needs to hear about because everybody else should be doing them too.
It is really a remarkable place. Of course, I was born and raised in Whitesburg, so I've been here for 57 years. I was actually a patient at Mountain Comp myself when I was growing up.
Okay.
The clinic started in 1978 is when we first opened, so we've been here for quite a while. But when I was in high school, I started working here some, and then as a patient, and then during college, I worked here some more in summer programs with health promotion and disease prevention programs. Got to know the clinic well. Knew I wanted to be a doctor, so went off to the UK to train. And then while I was in my training at UK Med School, we did rotations here at the clinic. And then I came back when I was a resident in family practice and actually set up some rotations here in East Kentucky and did some OBGYN and family practice. So the clinic has really grown a lot during that period of time. We were in an old hotel building in downtown Whitesburg,
right.
Had the Whitesburg location, and had a location in McRoberts, Kentucky, and a rural clinic out in Leatherwood, Kentucky. And I was just talking to our credentialing agent. We started at that time when I came back here in 1991, we had 12 medical providers. Now we're up to 68.
68.
68.
So needless to say, your facility is transformed a little bit. You're not downtown anymore.
Right. We're out of the old hotel building downtown, and when I first started working in 91, we'd moved from building to building. We'd outgrow where we're at in the hotel, and then we'd add another facility on and put a clinic there. We added a black lung clinic, and this continued to grow and grow, and then finally built this clinic in 1998.
Okay.
And we've actually added on here 5 times. So,
right.
And purchased the old Whitesburg campus and have administrative offices up there now. And in the process of putting in a HIV clinic and a hepatitis clinic up there, along with some other opportunities we have there to do some more clinics for outreach.
Yeah, very good. Now, just for people who are watching online or listening, I would describe this clinic as about the same footprint as a good-sized Walmart.
Yeah, we're about the size of a Walmart, and what we wanted to try to do, our patients have a hard time getting into clinic.
Right.
So we have multiple clinics, but in all of our clinics we try to replicate what we do here in Whitesburg. Whitesburg is our base clinic, but we want to make it so they can get everything they need when they come for that one visit. So if you take off an afternoon and come over here to be seen at the clinic, we want you to get all of our services that we have. And currently at this location, we have family practice, internal medicine, OBGYN, pediatrics, pulmonary medicine, infectious disease, optometry, dentistry, cardiology, cardiovascular lab, and podiatry.
In some ways, it's like a hospital without the inpatient.
Right, and if you come to do all that in one afternoon, we try to fix it so you can get the whole afternoon or the whole morning and get everything done at one time. So it cuts down on transportation issues. Our folks here in Appalachia have a hard time with transportation. Sometimes it's hard to get to and from, so if they can get to here, we want to give them all they can at one time. We also have full lab and x-ray, and we're associated with a hospital here in Whitesburg, which is an ARH hospital, and so we're associated and admit patients to that facility there, and also then refer to Pikeville and other cardiology areas and for specialty care. Pikeville has a clinic here in Whitesburg, specialty clinic for ortho and cardiology and neurology, so it makes it handy for our patients while they're here to go across the street and see the specialty clinic, or go to the back here where ARH has a specialty clinic and see their specialists while they're here.
Right, and this is one of the things that drew me to this clinic personally, because I remember the very first time I walked in here, I went and saw my doctor, who's one of your family docs, and he said, well, have you had a EKG run? Have you had your blood work done? Have you had a chest x-ray? He went through a whole list of things that were all part of my own family history that I should have done, and I said, no, I need to get all that done. And I was expecting him to, write me a prescription. You got to go to this clinic and go to that clinic and go to the other one. He says, oh no, we'll be done with you in 45 minutes. And he gave me a little card and sent me around. And literally 45 minutes later, I was in my car driving away thinking, what did I just step into?
It's really amazing. And We built that way because, when I take off a day's work,
Yeah.
I don't like to waste time. I want to go somewhere and get everything done. And so we have people who work during the week. And so we have a Wednesday night clinic from 5 p.m. to 8 to accommodate them so they can come in and get everything done. We have a Saturday clinic here. We're also open on Sunday. So we're open 7 days a week here
Right.
and offer patients the opportunity to come in when they're not working. And we offer all these specialty care when they're not working too. On Saturdays, we call it Super Saturday. So the one Saturday a month, we have all our specialists come in so you can schedule in and do everything on a Saturday instead of just coming to do one thing and have to go and do all these other things. Of course, some like to part it out, so but that will also break it into parts if they need to for that.
Yeah, there's so many ideas just packed into that paragraph you just talked about. Super Saturday where people can come in who are working because it's hard.
It is. It's
It's hard
difficult.
to get off, and especially in rural America, it's hard to get from point A to point B. And I think a lot of people who live in cities, that's kind of lost on them because, they wake up in the morning and they can be at this clinic and then 5 minutes later, even if it's a bus ride, they're over there. But here sometimes it's 45 minutes to an hour just to get from here to Pikeville.
Right. It takes time, and it's hard to get that kind of transportation. I lived in Lexington for 11 years and hated it because I hate traffic. You can't be efficient in Lexington because you've got to go so many places, and it takes 45 minutes to go to each one of them because of traffic. So we want to make it when you came here that you could get everything done. And what we saw is our patients were not getting preventive care. They were coming to the clinic when they were sick, but when they needed preventive care, they didn't show up. And so we have really focused on changing their idea of medicine from one of, I go to the doctor when I'm sick, to I go to the doctor when I'm healthy to stay healthy, but then when I get sick, I can go to the doctor too and get well. And so we've gone from, in the last 5 years, a rate of about 5% of our patients having preventive visits to having more than 68% of our patients have preventive visits. We also we really push cancer screening because we know in Appalachia our cancer rates are higher than anywhere in the United States. And actually, Prairie County, Kentucky, which we have a clinic in Prairie County, we're next to Prairie County, has the highest death rate from breast cancer and the incidence of breast cancer of anywhere in the United States. So it's so important that we offer mammography here, we offer access to colon cancer screening, and it doesn't need to be necessarily a colon cancer colonoscopy, but Cologuard and guaic testing of the stool. So we check different ways to make it easier for what the patient needs. And so our colon screening has gone in the last 5 years from a mere 9% up to over 70%. So
that's that's stunning. It really is, because if you understand anything about preventive medicine, you know that you're going to be able to lengthen the lives of those patients if you can catch cancer really early. So going from 5% to 70%, that's something that needs to be replicated. So
it's amazing.
So talk about how you do that, because I know that there's some really intentional planning and intervention that you guys do here that others need to hear about so they can replicate that.
In the colon cancer, we actually started with me. I turned 50 and I need to get a colonoscopy done. Well, you had to schedule with a doctor, take off a day's work, go see the doctor, then come back and prep another day, then go back another day and have a screening done. It's taken 3 days to have one done. So no one can take off 3 days of work for a colon cancer screening. It just doesn't work right. So we come up with a plan to make a thing called the direct colon cancer screening test at the hospital, a colonoscopy. And we turn it from a 3-day procedure to a half-day procedure. So you can prep over the weekend, go in on Monday morning, get your colonoscopy done, and be checked out. Then we found out a lot of people didn't like the word colonoscopy, didn't like to have that procedure done. And so we come up with a Cologuard test, which is nationwide now. And you can do it, it's a kit you take home, you put a stool sample in it, you call UPS, they pick it up, and it's a good screening measure. If you test positive for blood or colon cancer cells, then you have a full colonoscopy done. So we've got other options to offer. We also do a thing called a colon test for blood, occult blood. We do that here too at the clinic, and so we do it in the room with the patient. So multiple ways to try to help patients get the test, get the screening done, but not necessarily one test that fits for everyone.
Right.
And then, when I had mine done, I was 50 and had no problems, went for my screening, and found I had a precancerous polyp, had the polyp removed. I'd had one every 3 years for a period of time. But I wanted to be able to offer that same type of screening to my patients that I got in Lexington. So we replicated that here and saw our numbers go through the roof because people wanted to know. And then we had special days. We'd have colon cancer awareness days. We brought in the inflatable colon that the Cancer Society has, and you can walk through and look and see what a polyp looked like or colon cancer looked like. So they became aware and wanted to find out. and it made it a test that we talked about and didn't have to whisper about.
Right.
And so it made it accessible to patients and changing their perception of what it meant to be screened for colon cancer. Not that you had to have a colonoscopy, but you had other options to do. And we've caught so many cancers by doing that. It's just amazing. And likewise for other screening measures. Cervical cancer with pap smears, mammography for mammograms and getting mammograms done, and making it the same day. If a patient's here and I have a mammogram, we send them to get it done that day.
Yeah.
So we don't want to put off. We have become so unique at doing it. I have a group of patients that retired and moved to Florida, and so once a year, there's 6 of them. They catch an Allegiant flight out of Fort Lauderdale, fly into Lexington, drive up here, stay overnight with their relatives, come here, and then we do all their whole screening for the whole year.
How about
that?
that?
One trip, they fly back then the next day back to Florida. Because it takes them, up to a month to get all done in Florida. We can do it faster here in East Kentucky. So we have people coming in here to get their screen done so they can do it all in one day.
It's like medical tourism here in Eastern Kentucky.
So they get a discount ticket on Allegiant, come up and get a exam, get their screenings all done,
Yeah.
and we call them to report back down in Florida so they know what they're doing.
That's fantastic. Now, when I was here, I came in for a tour, I think, sometime after my first appointment.
Right.
And you took me around to this small army of women that you have who keep track of everybody's medical records so that if they drop in, they're called in for whatever test they've skipped.
Right.
Tell me about that.
Yeah, we implemented that. It's a kind of a screening group of nurses we have, and they scour the chart and see what that patient needs to have done. And so when the patient does come in for a visit, we have a little box on our computer that tells us this is what that patient needs. Whether it be immunizations, whether it be colon cancer screening, mammography, a blood sugar test, A1C test, diabetic foot exam. So it tells us what we need to do while we're there. And so they work diligently looking at all of our appointments for today and tomorrow and in the future. And they also look through the charts to see what patients may need that's not been here.
Right.
So we try to capture that while the patient's here during that one visit. And that's been very great at helping people get caught up on preventive health care. So that's been the push we've had for the last 5 years, is really to get caught up on that. And then expanding out into other areas. We had the clinic here in Whitesburg. We have a clinic at Isom, Kentucky, which is 7 miles away, offers our more rural patients access. We call this the urban center, a town of 1,000. This is our urban center, but that town's probably a town of about 100.
Yeah.
We also have a clinic in Leatherwood, Blackie, which is in Prairie County, Kentucky. We have a clinic in Buckhorn, Kentucky, which is Prairie County. A clinic at Boonville and Owsley County, which is one of the most underserved areas in the United States. So we have a clinic there and have providers there. We also then, that's on the Kentucky River side of Pine Mountain. Our clinics are separated by Pine Mountain, which is one of the larger mountains in Kentucky. There's 2 large mountains, Black Mountain and Pine Mountain. We settle in between the 2 valleys. This is the Kentucky River Valley we're in here. On the other side of the mountains, the Cumberland River Valley, we have a clinic at Cumberland, a clinic at Harlan, a clinic at Pineville, and a clinic at Millsboro.
Okay.
So we've really grown in the number of clinics too. And then we wanted to offer access to our black lung patients. We have a lot of co-workers here. And so we have one of the nation's largest, actually the largest black lung clinic in the United States is located here in Whitesburg.
Really? I didn't
So we
realize
offer
that.
services for that with our black lung clinic and have a we are the only black lung clinic that has a full-time board certified pulmonologist on staff. And so Dr.
fantastic.
Olam is our pulmonologist. He came from UK. He's been here about 20 years now, and really helps work with the coal miners on getting their black lung screenings done and the Department of Labor exams we do here on a daily basis too.
That's great. Yeah, I just walked past the pulmonary clinic out there. It was pretty busy.
Very busy. A lot of patients with black lung, people who have retired, people who are currently working. So we offer that services available for them 6 days a week for the black lung clinic.
Right. So one of the other things we talked about last time I was here was some of the programs that you're working on piloting. Give us just an overview of what you're piloting right now.
Yeah, we believe in innovation, and so we have a meeting every Thursday evening from 4 to 5, and we sit around a table and we innovate, figure out how to solve problems, and try to figure out what's best for the community. One such program that grew out of one of those meetings was the Casper program.
Okay.
And everybody's talking about this prescription screening, so you know who's doctor shopping and who has filled what prescription. We brought in a group of pharmacists, a group of law enforcement agents, and a group of doctors that were having a problem. And this was back in 1992.
Okay.
And came with an idea of what we wanted to have, did it locally, and then one of the sergeants took it to Frankfurt, and from that program grew the Kentucky Casper program, which is a model for the United States and the world today on how well efficient it is.
Right.
So that grew out of a little discussion here in Whitesburg. We also had another program where when our coal miners started losing their jobs, when we changed over from coal over to gas,
Right.
and a lot of coal works went down, they had never been out of work, and so they had no idea how to apply for resources. And so we gathered around 4 different agencies, pulled them all together, and had a health fair for them. But it had other options too about housing and refinancing, mortgaging, health care, and introduced them to all that. And then we give that program over to Kentucky XEP, and they developed a work program for them, work training, back to school, resources from human services, that type of thing. So handed it off to people who were better equipped at it. We're healthcare providers, but we got a lot of great ideas we want to share. Another idea we had was, trying to get people healthier is providing better food for them to eat.
Right.
And we used to have a lot of community gardens here, and people got away from doing that and got more with fast food and more with prepared foods. And so we want to return to that. And so we help with the help of the city of Whitesburg and some grants through UK to set up a farmers market.
Okay.
Got the farmers market going, and then from there also grew another group called CANE, Community Educational and Agricultural Network. And it's a community kitchen where people can go to the farmers market, and we have a program in the farmers market called Pharmacy, spelled with an F. The PH has changed over to the F.
Oh, has it?
F-A-R-M-A-C-Y.
Okay,
so
gotcha.
Pharmacy,
Sure.
like the pharmacy you go to, but you get a prescription that says, okay for pharmacy, F-A-R-M-A-C-Y.
Right.
And so we give people who qualify based on having 2 chronic illnesses, being a child or being a pregnant mother. They can get $10 of food per week from the farmers market. They get a voucher. They go to the farmers market, get their coin, and they can spend their money at the farmers market. And so it provides them with healthy foods,
right?
But it also provides our farmers with access to sell their foods at the market.
Right.
And so it helps both groups, both startup farmers, and we've had several startup farms now. We've got one farm that raises jelly, one farm that raises beef, one farm that raises poultry, lots of vegetable farms going on, and got one, our extension agent, he has got a blueberry farm.
Oh, good.
And so lots of great things out there. And then as we grew that pharmacy program, it grew and grew, and we got more grants. We wanted to incorporate exercise. And so another 100 people, we allow them, they park a half mile away from the farmer's market and walk in as a group. And we talk to them while we have them walking about proper nutrition. And so we get to talk to them, and they walk up there and they get another $10. So they get $20 per week to spend at the farmer's market. And so teaching them about preparation of food. And so at the farmer's market, it's grown from just 2 or 3 sellers now to about 20. And also being able to provide them with fresh food samples while they're there, and nutritional expertise. Our dietitians there, and we work with them on different recipes they can use. Then we saw that a lot of the food they were buying was going to waste because they couldn't use it all in a week. And so that's where CANE came in, the Community Agriculture Nutritional Enterprises. I think what the acronym stands for. But Mike Collar, CEO, and Valerie Horn, who's over the farmers market, came up and met, and we went with some other groups, and we created this community kitchen. So it's a room available for meetings, but also they take the food from farmers market and teach people how to can it, how to preserve it, freeze it. They have canning access, and they also have their own program going where they're canning jelly now. Then they're canning over 15,000 jars of jelly per month that they're selling on retail.
How about
and
that?
so that's really taken off too. So we've encouraged that. We have another guy in the community who has started beekeeping. He's got Ted's Honey. He's marketing it all over the state. So out of that farmers market has grown several other programs to keep feeding that farmers market and to make it grow and have a more lasting effect for the patient. We have a lot of cooking classes up there. So we have one that teaches them how to make salsa, one that teaches them how to can pickles, how to can corn, how to can kraut, so that things they buy at the farmers market, they may be able to use it all that week, but they can start to preserve it, be used later on in the wintertime.
Right.
So that's been a great
and all
program.
that contributes to health too,
Yeah.
because we know that the first step in health is getting good food.
Right.
And
proper nutrition and exercise.
As much as we like to occasionally visit those fast food restaurants, living in a fast food restaurant's not a good place to live.
So we show them how to eat well. And I had one patient, he really got into it, and he credits it to okra. So we taught him how to grow okra. He grew okra. He started dieting, and he lost over 150 pounds.
Oh, my word.
And ate a lot of okra, and learned about exercise at the walk program. He's in the walk program too. So seeing positive impacts. We saw A1C numbers drop by a point people who were involved as compared to others who were not in the farmers market.
That's great.
So it's grown to a point where we can't provide access to all the patients we'd like to, but as many as we can, we try to.
That's
and we
good.
expanded out not just in Whitesburg, also to some of our outlying clinics too. We have a farmers market in Harlan, we have a farmers market in our Leatherwood clinic. And so what we do here, we also replicate in our smaller clinics on a smaller scale.
Sure.
And today is the opening day of farmers market at Leatherwood today. So it opened. Last weekend was opening of Whitesburg's market. So doing more with the community and trying to keep the community involved in their own clinics and making them feel ownership in the clinic too, very important.
Excellent, excellent. Well, we're going to take a little break. We'll come back in just a minute and finish up talking about some of the other innovative ideas that Van and his doctors have been putting together. This is Appalachia Rising.
You're listening to Appalachia Rising, presented by the University of Pikeville.
Welcome back to Appalachia Rising. I think you can see that this is a pretty interesting podcast with some really great ideas. But before we get too much further, I want to go back to the idea of the pharmacy program because one of the things that we try to highlight in this podcast is how do you go about starting a program like that? So with the pharmacy program, tell me about some of those early steps and how you got that program going.
Well, that's what we really like to do here, and the group of leaders that I work with here at the clinic, Mike Collar's our CEO, and Teresa Dotson is our CFO, and she's over educational services too, and works with the nurses who are working to try to help with preventive care. So we all have different titles, but we all like to work together on new projects,
Right.
and that keeps the blood running, keeps us enthused at these projects, and then we'll get it going. We'll have a meeting, and at 4 o'clock meeting is where we grow a lot of our ideas. It's called a leadership meeting. So we bring all of our leaders from the clinic in. There's about between 10 to 20 of us. And we sit at a table and we hammer this out, and then we figure out an idea like the farmer's market. We had thought about that and wanted to help improve the nutrition of our patients, and so we try to figure out how to put it together. And so Mike Collar, he's actually a farmer, and he loves farming. He's into hydroponics. He's got one of the high-rise hot houses. They got a different tunnel. It's called a tunnel, and
Right.
We actually got funding on a recent grant for that for 14 in Letcher County through a recent
great.
funding program. So we have multiple people with these tunnels they can grow vegetables in early and actually raise strawberries and cabbages. So at the farmers market this last week, that were way ahead of the croc times because they're raising them in these tunnels.
Right.
And Mike can tell you all about that. And so he had a lot of expertise in it already. So we sat down together, and from his ideas, we worked it out on how we do it. He came up with the term pharmacy.
Right.
We kind of threw different names around, and that came out well. And so he kind of leads that agriculture part because he likes that idea. And so we used his expertise, and then we were able to lend in our expertise on how it would affect patients, how patients would earn the money, who would set the finances up, how it would work, and how we'd have cutoffs based on income levels, and how we do the farmers market. And then we try to reinvent that too and keep adding to it. So the farmers market's grown from an idea to get some fresh fruit and vegetables to our patients. Initially, we started buying it from farmers markets from outside the area and bringing it to them.
Right.
And then we were able to have our own farmers sustain it. So it give the farmers an opportunity to sell their growth of their vegetables that they've grown, and then to expand it into meats and poultry and other items that they have. And then bring our dietitian, nutritionists into it to talk to them about it. Our diabetic educators are there working with our diabetics. And so it just brings in a whole group. And so it just grows and grows by, we start out with a core and we add different layers on. And that layer tends to make it better each time. And then they had the cane project come on top of that. And then our city has worked with our farmers market, and we got the Live It Amp concert series.
Okay.
And that's a group of concerts that we applied for a grant for, and all over the United States. I think it's about 20 different sites, and so we qualified last year. And actually, our town had more signatures than places like San Diego, California did for their program. And so we had 3 or 4 in Kentucky. I think Berea, Millsboro, and Whitesburg. I think was the ones last year. I'm not sure who got this year, but we requalified. And so we thought, well, we're getting this concert series, so we'll have our farmers market the same day. And so the farmers market is there on Thursday. We have the concert. The farmers market runs from 3 to 6. On Thursdays, it's also all day. It's half a day on Saturday.
Right.
We have a midweek session and a weekend session, so people can arrive at different times. And then we have the concert series, and so to the concert series, we add that onto it too. So we provide entertainment, and we also do something medically informative, like we talk about colon cancer, about breast cancer, about high blood pressure, diabetes, between the farmers market and the concert, so we can get information about that. So bringing the community in for an event that lasts all afternoon, that you can come and go at, get fresh fruits and vegetables, be educated about medical topic, but also hear some good music, and it's a variety of music. It may be the Lexington Philharmonic may send a group up to play one night, and you may have a bluegrass group play the next week.
Right.
It goes for, I think it's 10 or 12 weeks it goes for. So it just keeps to grow. So we can take an idea, a spark, and then make it work, and then grow it to be something that's just fabulous. So I invite you to come over one Thursday night.
Oh, that'd be fun.
It starts after Labor Day, after Memorial Day, and runs through past Labor Day. And you can see the farmers market at 3. You can get the medical lecture they have going on as demonstration, and then you can stay for the concert. And the music's just wonderful. Pull up a chair and sit out there and enjoy the atmosphere. And then they actually add more of that. They wanted to provide healthy meals, and so they started doing these healthy meals. And the group that had the best table decoration, healthiest meal, got an award.
How about that?
So it just keeps growing and growing and growing. Like anything we do here, we want to add to it, make it better and better.
Yeah.
And
I think I'm going to wait for blueberry night because I love blueberries. But yes, go ahead.
When the blueberries come in, we'll have to check with our extension agent. He raises those on an old reclaimed strip job.
Oh,
So he
that's
raises
great.
those. So
Yeah,
that's
great
a
spot.
whole story. You should go talk to Shad, our agriculture agent here in the extension officer, and do a podcast with him, because he's really done a tremendous work within the farmers market. You could do a whole show on the farmers market.
Oh, I bet.
It's just amazing.
Yeah, I bet you could.
And on Kane too, the Kane Kitchen. We just had a wedding there last week that would outdo any wedding I've seen in any big city.
Wow,
It's just
no kidding.
amazing how they've decorated. We purchased the old high school. So we've done so many things. I'm just so excited to come to work, because we've got these other ideas, and when we have a new idea, everybody wants to jump in and do something new. And I guess the biggest thing we got into the last 2 years has been addiction. You know,
Right.
addiction was a horrible problem here in all over the United States, and especially in Appalachia. And we really didn't know what to do with it, because we didn't think there was any hope for these people.
Right.
And I met with a guy named Tim Robinson over at Jenny Wiley Theater, and my kids were teaching over there, and his kids were going, and he was telling me about his recovery group, and so we teamed up with addiction recovery centers, and I went on and toured, and I was always a non-believer that people could recover, and he showed me that there is hope, there is recovery. And so he turned a doctor who did not want to deal with addiction into one that's I got both feet in and the whole body in and head deep in now. And so we came back with his ideas, and we set up with him and some more people, and we started meeting, and a meeting of 3 people grew into a meeting of 10 people, grew into a room of 60 people.
Yeah.
And over the last 2 years, we've treated over 500 patients. We have addiction recovery, we have medication assisted treatment here at the clinic. We offer Suboxone treatment here. Tim offers recovery centers. It's really just grown now that small idea into a treatment program that's incredible. We call it HEAL, Help in Addiction for Life. It's we fall under Unite, Operation Unite that Congressman Rogers set up,
Right.
and also the SOAR program he set up for saving our Appalachian region. And what HEAL did was take a community who had lots of resources, but a lot of people working in the dark. No one knew they were doing this or that.
Right.
And so we used our influence to bring in everyone into a big room and talk about what they were doing, and then found out what resources were available, and then model them to be used to their treatment, and found out what everybody does best. Our health department, they do a wonderful job with needle exchange. So they took over the needle exchange program and vaccinations for hepatitis A and hepatitis B. So that's their portion, and divide up the labor. Unite was already doing the Give Me a Reason home drug screening for parents of students, and they do a drug screening. It's free of charge. They do it at home. It's a urine test. It checks for 6 different drugs, and it gives the parents reassurance their child's not using, but also gives the child a reason to say, hey, listen, I can't take drugs. My parents drug screen me every 2 weeks, and so I can't do it. And Unite also had a good take-back program, taking back old medications out of prescription cabinets, and they had 8 different areas in the clinic, and then the county could take back medication. So our take back has been incredible, getting medicines out of the medicine cabinet that could be abused and turn people into a non-user into addicted, and got that going. I got my waiver program a year and a half ago, and so I have a complement of 100 patients I'm taking care of with medication-assisted therapy. Nobody else at the clinic wanted to do about it, so we don't want to really deal with those patients. And so we showed them how there is hope and how we get people into remission, into recovery, and that addiction is not a choice, it's a disease. And educated the community about it. The community was, we don't want any drug treatment programs here. We don't want to deal with those people. Well, those people are here. They were in our lobbies. They were our kids. They were our nephews, our cousins. And so we just taking care of our people in our community and offering them help and seeing tremendous recovery and tremendous remission. And we brought our judges in on it and the drug court combined with them. And so really, HEAL didn't really start anything. All we did was work as a facilitator, taking what resources were here, saw what we had, molding them into a group to treat, and then from that grow a larger treatment program and add the resources we didn't have. And so now you couldn't find any better treatment anywhere. We actually have come so far now that our jailer and our sheriff, when you get arrested or get put in jail, they don't call me or call us to see the patient, see if we can get them in recovery. They're driving them straight from arrest to recovery. So offering that offer like the state troopers do with Operation Angel Care, straight from our jails. And so last week, our jailer took 3 different people arrested straight to recovery. So we know the jail's not a place to do drug treatment, but recovery centers are. We're also doing inpatient detox for a hospital. We teamed our hospital, and we have a bridge clinic, so our hospital ER sends patients to us immediately. So we could do a whole program just on what HEAL and Unite and ARH and ARC have done to treat our patients with substance use disorder here in the community. And they don't feel isolated now. They don't feel like they're left out. And we don't make a difference. You know, they don't go to a special clinic. They're out in my patient lobby with the people who have high blood pressure, diabetes, and they come in, they get treated. And we encourage all clinics like we are. We're a FQHC community health center that everybody take care of their own patients. We don't need any specialty clinics to do it. You've already got the tools you need, just put them to work. And so that program's really taken off and doing wonderful.
And really, it's the nugget of the idea, I think, that you got everybody together and you said, let's figure out who's doing what and doing it well, and then we'll just treat people like people. And even though that sounds so simple, it's an idea that we forget about in medical care across the country. You know, we're so interested in pushing people through as quickly as we can that we forget that people are just people.
They're just people. And, I remember when we first talked about the medical staff, a lot of doctors said, we don't want people like that hanging out at our health department because we got pregnant mothers going there. Well, we had a lot of pregnant mothers who were users and who were addicted, and we actually did a neonatal program here. We have 2, and we're coincided with our MAT, and so they do neonatal treatment, and we've seen our rate of addicted mothers go down. We've seen the rate of children having to be sent out for treatment from neonatal abstinence to as high as 30% down to less than 10%. So the results are there. And again, it's just coming with a great idea and having the people who want to jump in and work on it. And then it's actually easier to implement in a small area because we know everybody.
That's right.
You know, I can call up the district judge. I remember I called him up and said, listen, Kim, we got this great idea. He goes, Doc, I've heard everything on treatment. You can't take care of these people. They belong in jail. He's our biggest promoter now. He goes around and talks about what a great opportunity it is. He's sending people straight from the courthouse and from his court straight here to get, and we don't just do treatment. When you come here, say you got arrested and you were addicted, and he come to his court. He was seen down here. We do a full physical, have you do the optometry, screening, mammogram, pap smear, everything that the patient might need. We do all that first, and then work on the treatment program all the same day. Get them to see we have a behavioral science group now that works here, and most people who have addiction problems have underlying mental health issues, so we address those and treat those. They see our psychiatrists, they see our behavioral health workers, and then we see what works best for them, whether it's a residential recovery or if it's outpatient treatment. And most patients can be treated outpatient, and we offer them counseling sessions, case management, all that right here under one roof, just like we do our other patients. So it's just a matter of seeing what a patient needs and being able to provide it to them right here in one spot. And our patients, I mean, it's just night and day to see the difference in the way they're improving, what they're doing, and not just in addiction or substance use disorder, but also in our diabetic patients, our colon cancer screening patients, our vaccination programs, our pediatric programs, and our OB program. The OB program for the mothers has been wonderful. And a lot of mothers, they would have a baby that would go into withdrawal and lose their baby, so services would take the baby away. And so now they have an opportunity. they don't lose the baby, they can maintain their baby, keep their baby at home with them, and use the resources we have available to try to treat them and keep them in remission. And we know it's not a disease that you could ever cure, but you can treat to remission and try to remain in remission. But if they relapse, we welcome them right back in. I had a patient 2 weeks ago, he relapsed, got in trouble, got arrested. He appeared in court. We sent him to a addiction center. He stayed 2 weeks. He's back today, getting back into his medication assisted program, getting life back in line, going to work tomorrow.
Good.
And the key is getting him back home, getting him back to work, and getting him back into treatment. And so that's what our goal's been, and we've had great success with that.
Yeah, it's that balance of treatment and work. I read that a lot when I look at addiction care. You know, a lot of times folks will come out and they don't have a job to go to, and then they've got time on their hands, and then the temptation just rises and the addiction just comes. But if they're busy and they're working and they're being productive and doing medical care and counseling, then they make it through and they're doing well.
Yeah, that's the key. And then I think, you know, the other thing we encourage our doctors, don't be a 9-to-5 doc.
Right.
You know, we practice, I was country doctor a year back in 2017.
Right.
And so when they come to the interview, it's like, what makes you a country doctor? I said, well, I take care of medicine the old-fashioned way. I do hospital rounds. I take care of patients at the clinic. I take care of patients at the nursing home. We cover the whole family, do it all.
Right.
But we're not a 9-to-5 doc. 5 o'clock, you don't go home. You go out in your community and get involved. And so we encourage all of our doctors to get involved. And we've been able to do a lot of great things. One thing we did, my daughters were interested in this community service, and I said, the old Carcassonne Square Dance has been around forever, but it was about to die. They were down to 2 or 3 people showing up at the Carcassonne Square Dance, and it even danced up at the Kennedy Center, and it just kind of wore out, and people got involved in it. So we went in there and cleaned the place up, put a new roof on the place, did a lot of work, did a lot of PR, had a big health program there, a health fair, and a place where they were getting 2 or 3 people show up for a square dance. We had 400 people show up from all over Kentucky and 6 different states.
Wow.
Had a huge square dance, had a health fair, got that place back in the eye of the public. They got enough donations in that first health fair to pay their heating bill and electric bill for 2 years.
How about that?
And it continues to grow and prosper now. And what was dying has now been rejuvenated. And people from all over come and want to go to the square dance. It's one of our selling points in our community. Another great program we have is the Cowan Community Center.
Okay.
They get a lot of grants to do projects there. And our farmers market and our canning program actually started there first before it became cane and moved to a new facility. But again, there they do storytelling. They have a local drama program there. And they kind of had a lot of interest lost in their area. So we went and partnered with them and did Christmas on the Creek.
Okay.
And did a big Christmas health fair there. Again, brought in a huge crowd, showed people what the resources were, showed us what was available there. They got some more grant funding, and now they're doing all sorts of projects, but they've been doing that on their own. They have a great network of community service in that area. So just one thing after another, and what is, you never stop because we keep coming up with new ideas. We partner with UK on a program called A1C.
Right.
And it's a program UK wanted to do to try to help diabetics. And so we partner with them. And so we go out to churches on Sunday. And after church, we go in and check everyone's blood sugar, so what their A1C is. And if they have an elevated A1C, we get them into clinical care so they can be cared for and diagnosed. So there's a lot of undiagnosed diabetics there. So there's a coordination with UK on that program. So we just keep going and going. And then one of my pet projects is Healthy on the Hill.
Healthy on the Hill.
Yeah, Healthy on the Hill. I went to school in Whitesburg. It's on top of this hill here in town, and it's called School Hill. And the school since moved to a new location, become Metro Central. So Whitesburg High School closed down. We purchased the old high school property and now have a clinic there. We have the cane program, the community kitchens there. We have a wellness facility for our employees there. And then in the parking lot, once a year, we have this huge health fair. It's always during Mountain Heritage Festival. We have a big festival here. Brings everybody in from the whole county comes in, and from out of state come in for kind of a homecoming.
Right.
And it's the last weekend in September. And so during that on Saturday from 9 in the morning to 2 in the evening, we have a health fair. Blood pressure checks, vascular checks, get scheduled for colonoscopies, importance of mammography. We have over 75 different vendors there showing out different medical opportunities and options. And so we started doing that 4 years ago.
Okay.
And we have entertainment, and then we're doing healthy cooking demonstrations. So a lot of that goes on. Then we also have a booth inside of the Mountain Heritage Festival where we continue that through the Thursday, Friday, Saturday, Sunday it lasts. So, you know, I try to do it in all of our communities too. Other communities we have clinics in, we get involved in their community festivals too. So we're available there to tell people about how to take good care of themselves, how to be more healthy, and then also how to be engaged in your community. Again, talking about that country doctor idea, that idea of that at 5 o'clock I don't go home and turn the TV on. At 5 o'clock I go out and do something in my community, whether it be with music, whether it be with farming, whether it be with food, teaching. We're involved in a Marshall program. We had diabetics, or our A1C control was really poor. When we first checked 4 years ago, 60% of our diabetics had an A1C of greater than 9, which is poor control. We've since reversed that. Now we have over 60% of our patients have A1C of less than 9 now, and 40% are still over. But one program we instituted was the Marshall program. We got a grant from Marshall University out of Huntington, West Virginia, and they let us take 25 patients, and we send a outreach worker and dietitian out to work with them on meal preparation, how to give their insulin shots, how to monitor A1C, proper diabetic eye care, and proper diabetic foot care. And that's two of the areas that we added into our clinic too that we saw was sorely needed. If it's that diabetics wouldn't get their yearly eye exam, so we added the optometry department in 2 of our clinics, and then we also added podiatry. So we have podiatrists that can do the foot care, and optometry can do the vision care, and we become a part of University of Pikeville with their optometry program. And then we recently expanded with ARH to develop a osteopathic internal medicine residency program.
Okay,
and
very
so
good.
that starts this July. We'll have 6 residents come in. Actually, it's 8. 4 here in Weisburg and 4 in Harlan. So
Okay.
combined program between our 2 larger clinics. And so we're excited about that, to have internal medicine residents working right here with our patients, so we can show them what we're doing and get them enthused about not just being a doctor, but being a doctor and a good citizen in the community with public service and getting involved in community efforts, and not just sitting at home at night, but actually getting involved with their patients. And when patients see you out there and see you going to church with them, see you at the farmer's market, see you at the Healthy on the Hill, see you at Callan Community Center, see you at the Carcass on the Square Dance, they're more apt to feel less apprehensive about coming to the doctor. They feel like you're just one of the community. And so it works out wonderful.
Yeah.
So we just had it's just so awesome to be able to work in a place like this where you can come with an idea and put it to work immediately. You don't have to wait to go through a committee or get a grant funding. We just put it up there and get going with it and grow it.
We're running out of time for today, but we might have to come back and film another one. Is there one more quick idea that you've been talking about? Maybe something you're not doing yet, but you're kind of wrestling with?
Well, we're working on lots of new ideas right now, and trying to make patients have better health and better access, but really making sure people have adequate access to health care. That's the key. And the extended Medicaid really made a huge difference.
Okay.
If anyone ever questions, was the extension of Medicaid necessary, they could come here to Weisburg and to Mountain Comp and see how much healthier our community and our patients are, and how much better our health care is here because of that. So we want to make sure that stays in place and we don't lose access to care. We want to make sure that people have access to health care and good health care.
Yeah, and I think it's a combination of things. I think it's the expanded Medicaid, and it's also committed doctors and committed healthcare team. So
That's
thanks,
the key.
Van. We're really proud of you. We're proud of the things that you do here for the Whitesburg community and also for all of Letcher County and the other counties that you operate in. Appreciate you a lot. Thanks for joining us
Thanks
today.
for coming back over, and we'll have you back over to some of these events so you can see firsthand, and you may want to do a podcast about them because they're each one just as awesome as the whole.
Well, I think this is our first mobile podcast, so maybe we'll have to go rogue next time we come.
On site.
That's right. Well, thank you. Thank you for watching and listening. This is Appalachia Rising, and it's great to have you with us. As you can see, there are a lot of wonderful ideas in Appalachia that need to be replicated in other places all over the United States. Thank you again for joining us.
Thank you for joining us on this edition of Appalachia Rising. For more information on this episode or others, visit www.upike.edu/Appalachia Rising.